अस्सलाम वालेकुम एवरीवन, वेलकम बैक टू द चैनल यूनानी मेडिकोस। एंड लास्ट वीडियो लेक्चर में हमने पैल्पेशन एंड परकशन ऑफ एब्डोमेन को कंप्लीट किया था। एंड दिस वीडियो लेक्चर इज़ गोइंग टू बी अबाउट ऑस्कल्टेशन एंड इन्वेस्टिगेशन ऑफ एब्डोमेन, एंड नोट्स आर इन द डिस्क्रिप्शन बॉक्स, so you can download it from the link. So what is auscultation? First of all, auscultation means when we hear the sounds of organ with the help of a stethoscope, that is termed as auscultation. And when we hear the sounds of the abdomen using a stethoscope, then it is termed as auscultation of abdomen. So what are the sounds that we found in the abdomen? First is the bowel sound. So bowel sounds are the sounds of the intestinal movements that occurs during the digestive process. And for auscultating these sounds, we will place our stethoscope just lateral right to the umbilicus and keep it until the sound is heard. So the bowel sounds are low pitched and intermittent and are at least 5 to 30 times per minute. So whenever there is a change in the normal bowel sound, such as an increase in bowel sounds, it indicates some pathology such as a small bowel obstruction, GI bleeding, or some sort of carcinoma. Then in absence of bowel sounds, in paralytic ileus, intestinal blockage, and peritonitis. Then comes the suction splash. So what is suction splash? It is the splashing sound that is heard over moderately large quantity of fluid collection. So whenever there is fluid accumulated inside the stomach, the sound we will heard is the suction splash. And the causes of this are the pyloric stenosis, intestinal obstruction, paralytic ileus, and the normal stomach within 2 hours of meal. Then comes the arterial route. So arterial route is produced by the blood flowing inside the arteries, and it is produced by the arterial turbulence. So whenever there is a turbulence in the blood flow, the arterial route is heard. When the blood flow is excessive or when the artery is narrow, listen for the route for applying the stethoscope lightly over the abdomen. And if the arterial route is heard, it indicates the increased flow of blood in the underlying vessels. So it may be due to hepatocellular carcinoma or any aneurysms. Then venous hum. Venous hum is the sound which is heard over the veins of the abdomen, and it is produced when there is increased venous blood flow, and this is heard between the xiphisternum and umbilicus due to the result of hypertension. So every sound has its particular side, it's a particular nature, its particular duration. After this comes the friction rub. In friction rub, it is produced by the friction between the inflamed viscera and the parietal peritoneum during the movements of respiration, and its causes are the perisplenitis and perihepatitis. So a very important topic is the investigation of GI disorders. So whenever you will know that the patient is suffering from this disorder, to confirm it, you have to undergo some investigations. So first of all, for the diseases of the abdomen, the examination of feces is done. So detailed stool examination is the first step in many gastrointestinal diseases such as diarrhea, malabsorption, unexplained anemia, and weight loss. So by examining these, we can find it out that which are the nutrients that are not thoroughly digested in the body, or what are the things that are excreted out from the body and which are not utilized by the body. So we will make a particular diagnosis by these examinations, and the quantity, color, physical characteristics, presence of blood, leukocytes, these may also indicate some other diagnosis. For example, the black color of stool may be produced by the altered blood or ingestion of the iron or bismuth. The pallor color of a stool is seen in the obstructive jaundice. The silvery stools occur if there are combination of obstructive jaundice with upper GI bleeding. The slimy stools are found in large quantities when there is large bowel disease, for example when there is problem in the large intestine. And for this, the tests to be conducted are the fecal occult, the test for fecal fat, and stool microscopy. Then comes the examination of vomiters. So examination of vomiters is also very important. So carefully look for the presence that in the vomiters, if the blood is present, bile is present, parasites are present, or sometimes the toxic substances like drugs and poisons are also present in the vomiters. So vomiters contains undigested material taken before 4 to 6 hours previously indicates some gastric disorders, and the altered blood in the vomiters give rise to the coffee ground appearance, which is also seen in cases of some poisons. Then fecal odor of the vomiters indicates gastrocolic fistula or hindgut obstruction. Then comes the ascitic fluid analysis. So for the analysis of ascitic fluid, aspiration of the peritoneal fluid is undertaken, and for diagnostic and therapeutic purposes. So aspiration is done in the midline in the right iliac fossa and the gross appearance of the ascitic fluid. So if the ascitic fluid is watery, then the protein concentration is low. If it is transparent and slight yellow, it is showing low cellular content. If it is cloudy in appearance, then neutrophils are present. If it is blood stained in appearance, hepatocellular carcinoma is there. If it is dark brown color, then there is biliary perforation. If it is black in color, so there is malignant melanoma. So while looking at the color of the ascitic fluid, you can make these diagnoses. The radiology of the GI tract. So this is also very important. Direct question from this comes from this topic. So first of all is the plain radiograph. So in this, the evaluation start with the films of the whole abdomen taken from the upper, upright and lateral position. So in this, saws like liver, spleen, kidneys and fetal parts like bones will be visible in the radiology, in the plain radiograph of the abdomen. It also reveals any radio-opaque calculi of the biliary tract, pancreas or urinary tract. So this comes in the simple USG of abdomen, that is the plain radiograph. And foreign bodies and bowel obstruction can be revealed in bowel perforation. Gas is seen under the diaphragm in the erect posture. Then comes the contact radiography, and it is useful in an anatomical abnormalities such as change in size, shape of hollow viscerals, ulcers, neoplasms, fistula, strictures, spasm detection. Stomach and small intestine, for this the barium meal is taken. So 500 to 600 ml of suspension of barium sulfate is made to drink to the patient, and the radiograph is taken at the 5 minutes, 30 minutes, 1 hour, 3 hour and 16 to 24 hours. So barium meal examination is also a very important topic, and in this, when the patient drinks that barium suspension, then these are detected, and delaying the process of meal and unusual hurry both indicates the diseases. So various disease can be detected by using the barium meal. So here we have completed the auscultation and investigation of the abdomen, and we have also completed the digestive system as a whole unit. So if you have liked the video, then please do like, share and subscribe the channel, and thank you for watching the video.